Welcome back to 12 Days in March. We'll pick up our discussion of oral health topics for USMLE Step 1. A PDF of this and all recordings are available at the 12 Days website. In terms of the broad overview, and for those who are viewing these out of sequence, in Section 1, we reviewed the important anatomy of the oral cavity. In Section 2, we produced a series of videos focusing on specific oral lesions. In this final section, we will focus our attention on the remaining subcategories of oral pathology, including congenital disorders, diseases of the salivary glands, dental pathology, and the ever-popular other category. The goal of this presentation is to hit on high-yield take-home messages, so when you hear a buzzword, you'll immediately recognize the correct oral pathology. So here it goes. First, we'll discuss congenital disorders, including cleft lip, palate, and oral findings related to osteogenesis imperfecta and congenital syphilis. As with other presentations, our focus will be on the oral manifestations of these multi-system conditions. So, let's begin our discussion with cleft lip and cleft palate. Remember that the palate can be divided into the primary and secondary palate. This distinction is based on the embryological progression and the development of the palate. The primary and secondary palate meet and fuse together at the incisive foramen. The medial nasal prominences fuse to form the intermaxillary segment, which, in turn, fuses with the lateral maxillary prominences to form the primary palate. This process is represented in yellow in the diagrams. An error in formation of the primary palate, marked by failure to fuse the medial nasal prominences with the lateral maxillary prominence, results in a lateral cleft lip. Depending on the prominences that fail to fuse, the location and type of the cleft lip varies. The secondary palate is formed when the palatine shelves, which also form from the maxillary prominences, fuse with each other and with the nasal septum. An error in formation of the secondary palate, that is, a failure of the maxillary processes to fuse with each other or the nasal septum, results in a cleft palate. Depending on where the fusion fails, the type of cleft palate can vary. High-yield derivatives on cleft lip or palate include a knowledge of which prominences fail to fuse. Here is a summary table detailing the prominences and what they form. Unilateral defects are most common. Let's move on to the congenital pathology associated with osteogenesis imperfecta and congenital syphilis. OI is a genetic disorder that affects the bones and teeth. The primary defect is a failure of type 1 collagen. As depicted, the failure can be qualitative with misfolded collagen or quantitative due to decreased synthesis. As healthy bone is dependent on mineralization of the collagen matrix, failure of collagen will predictably result in bone insufficiency. A mnemonic that is useful for remembering the common manifestations of the disorder is patients can't bite. B is for bones, as people with OI have brittle bones and are prone to multiple fractures. I is for eye, as patients with OI have a characteristic blue sclera representing visible choroidal veins. T is for teeth, as patients with osteogenesis imperfecta have dental imperfections, specifically opalescent teeth that wear easily due to lack of dentin. This is referred to as dentinogenesis imperfecta. E is for ear, because patients with OI often have hearing loss on either a conductive or sensoroneural basis. So remember, patients with OI can't bite. Bones, eye, teeth, and hearing. Let's move on to the oral manifestations of congenital syphilis, which include mulberry molars and Hutchinson teeth. Mulberry molars, as the name implies, resemble the mulberry. The primary molars will appear to have many rounded cusps resembling a mulberry. Pretty, but I wouldn't want them. Hutchinson teeth refers to a characteristic notched tooth that is indicative of congenital syphilis. From now on, mulberry molars and Hutchinson teeth equals congenital syphilis. Children with congenital syphilis can have other profound abnormalities, including corneal scarring and deafness. So these are the key congenital players with oral manifestations. Pretty straightforward. Let's switch gears and talk about salivary pathology. We'll start with a discussion about sialadenitis and its causes, followed by a review of the key tumors of the salivary glands. Sialadenitis can be caused by infection or obstruction that results in swelling and/or pain in any of the three main salivary glands. Remember, these are the sublingual, submandibular, and parotid glands. The parotid gland is the largest of the three and most prone to infection. We refer to infection of the parotid gland as parotitis, with mumps virus being the most characteristic infection. With mumps virus, the swelling is often bilateral. Parotitis can also occur due to bacterial infection. In this case, it will produce pus, which can sometimes be seen at the opening of the parotid duct. From our anatomy video, you'll recall the ductal orifice is found in the region of the second molar. Obstructive sialadenitis can occur due to stones or narrowing of the salivary duct. An obstructed salivary gland presents with pain right before or during eating, with swelling in the obstructed gland. Obstructed salivary glands are often recurrent. Tumors can also involve the salivary glands. Benign tumors are more common, and the parotid gland is again most often affected. There are 3 types of salivary gland tumors worth reviewing. These are pleomorphic adenoma and Warthin tumor, both of which are benign, and mucoepidermoid carcinoma, which is a malignant tumor. These tumors most commonly present as a painless mass. If there is facial pain or numbness, it suggests involvement of the facial nerve, and malignancy should be suspected. The pleomorphic adenoma is the most common of the salivary gland tumors. It is described as a mixed cell tumor that is treated by excision. If it is not completely removed, it will recur. While it is benign, it has the potential to become malignant, which is why it's important to remove once diagnosed. Warthin tumor, also known as a papillary cystadenoma lymphomatosum, is a cystic tumor with germinal centers and smoking as a significant risk factor. Mucoepidermoid carcinoma is the most common malignant tumor of the salivary glands. It is comprised of both mucinous and squamous cells and has a good prognosis when caught and treated early. Facial nerve pain and numbness can accompany this tumor. And that will do it for the salivary glands. Before moving on to the home stretch, let's take our final break. If you have any questions or concerns about any of this material, please email me at 12days. Thank you.